What's going on, everyone? Welcome back to my channel. In today's video we're talking about sprains and tears of the MCL ligament, which is a ligament on the inside of your knee. So if this is something that's happened to you recently, maybe you're an athlete and got hit by someone else, tackled or something and tore that ligament, or you fell, or some other movement in a sport that tore the ligament on the inside of your knee, stay tuned for today's exercises. I'm going to show you how to get your mobility back and strengthen that region. Alright, for this first exercise, we are going to focus on getting mobility back. Often after knee ligament injuries and just injuries to the joint in general, people have a hard time with their range of motion. So this first exercise is called a heel slide. I'm going to sit with my injured leg out straight, and then all I'm going to do is slide my heel along and bend that knee as far as I can. When you've had an injury like this, at a certain point in the movement, it's probably going to become uncomfortable. So just go up to the point where the pain starts and then go back out. And you're going to do somewhere between 10 to 15 repetitions like this 4 to 5 times throughout the day just to get your mobility back. The knee normally will bend to 145 or 150 degrees. So you want to be able to get back up to this amount of bend and then all the way straight. So just compare it to your other side, see what's sort of normal for you. So you'll do this heel slide like this. At a certain point, you might not be able to bend it all the way just on with the muscles on the heel side. Then you can take your hands and pull it in until you get full range of motion back. Okay, so start with that for mobility, a heel slide, and then as your range of motion comes back, grab it with your hands and pull it in. Okay, so the MCL is located on the inside of the knee like I mentioned in the beginning. It connects our tibia, which is this lower shin bone, to this upper bone, the femur. It's a small ligament that runs right here, and it can be stretched and torn, as I mentioned before. So after getting our mobility back, we want to strengthen the muscles that stabilize the knee, and especially the ones that run here on the inside of the knee, because they can help to stabilize the area and protect the healing ligament and also protect it from future injuries. So those muscles are mainly going to be one of our hamstrings, so we'll strengthen the hamstrings. A muscle right here called semitendinosus comes up across the medial knee joint line and can protect the MCL. We have a groin muscle called gracilis that runs right across here. And then lastly, we'll look at strengthening the quads. Even though they don't run right across that area, they're really probably our most important knee stabilizer. So the next 3 exercises are going to look at strengthening each of those areas. So I'm pretending like the injury is on my left leg in this instance. So for this first exercise, I'm going to lay on my left side. So my injured side is down here. And then I'm going to take the other leg and put it over the top just to kind of clear it out of the way. So this exercise is going to strengthen our groin muscles or adductors again, which go down and cross the inside of the knee joint line. So for this exercise, you're just going to lift your leg up like this into hip adduction off the ground. This will again work the groin muscles and help to stabilize the inside part of the knee. Start with leg weight. If this gets to be too easy, you can buy just ankle weights and put them down on your ankle just to increase the challenge a little bit. So for this one and the next 2 exercises, because they're strengthening in nature, we're going to shoot for 3 sets of 10 to 15 repetitions. Okay, so this is our first one for our groin muscles and especially that gracilis muscle, which goes down to the inside of the knee. All right, the next exercise is the one for our hamstrings. I'm going to use a tool here that can be really useful for hamstring strengthening and other exercises. It's called a core slider. Sometimes you can even just find furniture sliders that work the same way. It's got a smooth back and it just allows you to slide on the ground. So we're going to do a single leg hamstring exercise with this, and only the eccentric portion. Again, this will strengthen all of our hamstrings, but we're really thinking about semitendinosus, that muscle, because it runs right by the MCL and can help protect it. So what you're going to do is put your slider on the ground. You're going to put it under the heel of your injured side. You're going to lay on your back. So for this exercise, you're going to start with your knees bent. Just do a regular bridge, and then when you're in the top position, lift the uninjured leg, and then slowly slide the injured one out. This is going to really work the hamstrings and challenge them eccentrically. Go as far as you can, and then set your butt down, reset the position, bend your knees, and then lift again, lift your butt, and then slide out slowly. Now this is pretty challenging, this eccentric loading. This exercise is pretty hard, so if you haven't done these before, you might not be able to slide out really far. Just do your best. If you feel like your hamstrings are going to cramp, just set your butt down and do as many reps as you can. But strengthening your hamstrings is really going to help stabilize your knee and protect that MCL ligament. With this one, again, you want to think about 3 sets of around 10 repetitions. Because this is harder, if you can only get 5 or 6 repetitions in each set, that will still definitely build strength and help rehab and protect that MCL ligament. Okay, so that's our second one, a hamstring eccentric slider. So our last exercise is going to look at the quadricep muscles, which are on the front of the thigh. These are arguably the most important stabilizers of the knee joint. As I mentioned in the beginning, MCL injuries typically happen when the leg gets hit or the person twists their knee, and especially if it goes into this valgus position. As the knee comes in and deviates inwardly, it separates the tibia and the femur, and that ligament's right there. So if you pull these bones apart, it can literally just tear the ligament. So we want to strengthen our quads and improve their control and strength, as that will really help to stabilize the entire knee joint. So one of my favorite exercises for this is a lateral step down. You're just going to get a step like this. It can even just be a stair at your house. You're going to stand up on that step with your injured leg. And what we want to do is to build strength in our quads, control and strength in our quads. We're going to slowly lower down, sort of like a single leg squat, until our heel on the uninjured side touches, and then come back up. Okay, so you've got to work balance, neuromuscular control. You want to try not to let your knee deviate too much from side to side. So you're going to try to keep your knee kind of right over your toes, go down, touch your heel, and then come back up. You're going to do 3 sets of around 10 repetitions, and this is really going to work on your knee extensors, these quadricep muscles, which, like I said, are really the most important knee stabilizer. Okay, so those are our 4 exercises. There's other ones you could do, but these are some of the best. Start with getting your knee mobility back, and then work on strengthening your hip adductors, your hamstrings, and your quads. If you have any questions, guys, please put them in the comment section and I will get back to you. All right, see you next time. Bye.